Hey, Assalamu alaikum. In this video, we will understand about the anal fistula. So basically, it is the kind of abscesses which that progress into the fistula. Here is the person which that is very painful in the large intestine area near the anus. So here is the ascending, transverse, descending, sigmoid, and rectum and anus of the large intestine, and cecum and appendix also the part of the large intestine. So basically the region here is the picture which that show the anal fistula. In this case here is the structure which that unruptured. So in this way the unruptured is here, which that is abscesses formation. This abscesses of fistula unruptured. Whenever it will be ruptured to exudate the other type of the liquid, basically which that is antimicrobial and the dead bacteria. So this is a lot more factor which that involve to cause the anal fistula. So here is the structure of the anus and rectum. So contain here is the abscesses. So it is a different type of the abscesses. There are different types like the supralevator and perianal, submucous and ischiorectal abscesses, which that is the basically drain the exudation of basically is the drainage of the external drainage of the pus. So pus formation will occur. So in this way here is the cross section of the rectum and anus which that show the abscesses. So abscesses can be formed and release and drainage the pus outside of the body or inside. So inside of the anus or outside, depending on the situation of the fistula. Cause of fistula is the Crohn's disease, inflammation, ulceration, and the anal glands infection and close the anal gland secretion to inflammation and abscesses formation, and trauma in anus as well as the infection and the diverticulitis. We will discuss in the next video about the diverticulitis. So the radiation therapy also cause the anal fistula. But important thing you should need to understand, the fast food eating chronically and daily and other bad eating habit which that also cause the fistula. But important thing is that the blockage of the anal gland which that cause the abscesses formation. So here you can see this is the superficial and basically here is the again I am drawing the picture which that understand the extrasphincteric fistula, and then the transsphincteric and the superficial. These three type of the opening the drainage of the fistula due to the abscesses formation to exudate the pus, which that pus is also contain dead microbes due to the inflammation and the immune response. While on the other hand the other things like the fluid and edema formation. Here is the adipose tissue, and this is the levator ani muscle and the puborectalis muscle, and this is the internal anus sphincter muscle and the external anus sphincter muscle. So remember external anal muscle. So in this case the thing is that for simple to understand is here, which that is the fistula tract formation where the abscesses formation, and this abscesses basically link with the blockage of the gland, and this will lead to abscesses formation due to the accumulation of the pus due to the pus formation, and that basically will release the pus inside or outside. So remember this external drainage and or internal, so it depends on the nature. Anyhow, the treatment can be a surgery, the fistulotomy, and the advancement flap procedure, and the medication, the antibiotics, and the higher fiber diet basically which that decrease. So let's understand about the inflammation and abscesses formation inside of the anus, or the basically inside in the skin of the anus. So inside mean the rectum or anus. So here is the skin basically contain a microbiome inside the anus or rectum or lumen. So basically contain microbiome, and whenever the rupture or injury or gland block or ulceration, This ulceration, injury, and gland block will lead to rupture the epidermis. When rupture the epidermis, the dermis and epidermis. So remember, in this way, the invasion of the pathogen will occur. This is the barrier immunity, as a barrier, the skin. So in this way, the activation of the dendritic cell and other innate immune cell will lead to activate the adaptive immune cell, but mast cell also activate by the IgE antibody production due to the adaptive immune response to produce the histamine, that is the hypersensitivity response. So in this way, the permeability will increase on the dermis and the blood vessel to recruit the further immune cell. On the other hand, the rupture of the skin will lead to produce cytokines and subcutaneous tissue mediators also produce within the 2 hours, 0 to 2 hours. And in this way, it will basically recruit the Langerhans dendritic cell will recognize the antigen to recruit the neutrophil and macrophage. This will lead to necrotic cell death also occur, and on the other hand, the apoptosis will occur. And in this way, this is the basically is the after 2 to 24 hours. So the abscesses formation by inflammation will occur. This is the lead to increase the inflammation. And this inflammation basically also the mast cell, which that increase the permeability of the endothelial cell of the blood vessel. So in this way, more recruitment of the immune cell due to the production of inflammatory mediators like the cytokines from the injury site will lead to increase the cluster formation of the antibodies antigen complex whenever the pathogen will invade. So on the other hand, important thing is that the inflammation will progress, chronic inflammation, endothelial dysfunction will lead to chronic inflammation, and the cytokines will produce from the neutrophil more and more for recruitment, and mast cell also produce the histamine for the endothelial dysfunction to recruit more and more immune cell, and where the immune cell will cluster with the antibodies, and opsonization of the pathogen will become a dead pathogen. And this basically is the necrotic plaque formation will occur, which that in the form of the abscesses. This abscesses is basically contain a dead neutrophil. The basically is the you can see the pus formation, which that contain a dead neutrophil, and the necrotic area, which that contain antibody antigen complexes and neutrophil and other macrophages, some dead cell will lead to increase the necrotic plaque and layer of the basically stability to increase, and this pus will ultimately rupture and will lead to drain the pus from the outside of the body, from inside, like inside of the anus release, or the outside near the anus, as shown in the diagram previously, which that I show. In this way, inflammation will progress, will lead to fever, pain, and exudation increase. So this necrotic plaque formation will occur. I hope you make sense about that. If you like my video, please make sure to subscribe, like, and share. See you in the next video. For this and bye. Allah Hafiz.